Good morning, Dr. Lennon Foo.
Morning, Roman.
How are you doing?
Good. Ready with my coffee.
Yeah, I kind of totally stressed today. I was like drinking my coffee earlier.
All good.
So, I'm so excited to have you here today. You are in UK.
Yes, that's right. I'm very excited to
I
be here
got
as
kind
well.
of like the background, I got kind of like what's happening.
It's just a background. It's a consulting room. It's not the Caribbeans, I'm afraid.
Perfect, but you give this kind of nice flair. Um, Tell me a few words about yourself. Um, I got very interested in what you do. I'm interested in your book that you just announced. We are together in an international association of canine psychology, and I was like, met you there. I was like, oh, wait a minute, this guy knows his stuff, and I was like, we need to share that. So tell me a little bit about yourself and how did you got into this, what most people think, money making business, and what is your passion around helping people and dogs and pets in
Yeah,
general?
sure. First of all, I'm very, very grateful to be here. So, Roman, thanks for inviting me. It is a big pleasure to be able to be on a platform like this and just to share a few views. So my name is Lennon. I'm from Singapore, and I grew up in Singapore before coming to UK back in '99 to the Royal Vet College in London to study vet medicine. And since then, I've been working in sort of the southwest of England in Devon for the past sort of 16 years. And I remember being when I was the reason why I became a vet is very, very classic. Reading James Harriet and liking animals, the very, very cliche. I just want to do something with animals, and being a vet was the most straightforward thing to do in Singapore. So I just diverted my passion and my academic subjects to take for GCSEs and A levels just for vet medicine. I remember that my sort of personal mission to myself is people ask, why do you want to be a vet? And I'd be like, because I want to save all the animals in the world, which was the classic thing. Then that remained to be my sort of mission statement, the reason why I wake up every day during college and the first 2 years of working. And after that, I quickly realized that actually that is not what I'm doing. And the reality is that, the consultations I see helping people with their animals, some of them, without sounding too harsh, and you know exactly what I mean, the best thing for the animal is actually to take them off the owners and get a different owner because not all owners, not all guardians, not all carers are meant to have pets. And I realized that if I keep saying that to myself, as in my personal mission is to save all the animals in the world, I'm going to get very, very depressed very, very quickly because that's not what I'm doing. So I had to change my mission statement and tweak a little bit, which really led me to my true calling or my real founding of want to be a vet. And I've changed my mission statement to my job is to improve the bond between the animal carer, the animal guardian, to a bit between that bond and the animal. That's my job because I always had that question of, it was asked before, which is a better vet? The vet that has diagnosed the most amazing disease and come up with the most amazing cure, or the one who can convince the pet guardian to give the tablets 5 times a day. So I realized that over time, we are taught all about animals, but in my mind, veterinary medicine is 80% human, 20% animal. People may say that it should be 50-50. My challenge is that maybe when I say 80%, I'm saying 80%. It is much harder to convince the owner to have the skills to communicate with the owner than it is to learn the disease of the animal. Because a cat is a cat, diabetes is diabetes. There's only so many methods you can do to treat that condition. That's not rocket science. But to convince the owner to be able to give the injections or to keep the cat going, to say that it's actually worth it, that's a whole different technique. And that is why I founded my practice, Amity Vets, which we're extremely a sort of a pet guardian centric. And our sort of ethos is to empower you through education. And we found that one big thing that's missing is education, really, which is why we spend a lot of time doing education, which is also why we have our own YouTube channel, which is also why I've specifically written a book just for pet guardians like yourself
We will talk
to
about that.
make
So,
sure you get the best from
yeah,
your.
I got this. So today I have Dr. Lennon Foo, because I want to ask questions, and I'm sure you have many answers to give, and I'm sure some of you already know what I'm up to here. We're going to talk about how is the relationship between a veterinarian and the guardian and the dog or the pet. We'll talk about more about dogs today. So this golden triangle. We're gonna
Mhm.
talk. I will ask questions about how to prep your dog for the vet office, how to be proactive. What is the meaning of fear-free veterinary care? We're gonna talk about pet health awareness. We're gonna talk about vaccinations, over vaccinations. That just saw a workshop yesterday, video presentation we did yesterday. Very interesting. We're gonna talk about Titer testing, over vaccinations, and attached behavior patterns. We're going to talk about pet behaviors that are screaming for underlying medical conditions, and you are exposed to them. We're going to talk about informed decisions. Most people missing that part. I will talk about how people can ask questions and be prepared coming to the vet, who is knowledgeable like you, to help get a better profile of the dog's health state, because it's we're going to talk about that. We're going to talk about integrative veterinary care, and we're going to talk about behavior drugs, steroids, and tranquilizers that most people are not aware of, and we want to make sure the message is done correctly. So, for you guys who are watching, please tell me where you guys are from, because we are all over the world. Dr. Fo is in UK. We are in Western US, in the West Coast, Northwest Coast to be exactly. And I would like to hear where you guys are from and where your questions are coming from. So during our show, you can ask questions. We're going to keep them together. I'm going to ask the questions pretty much by the end. We have about 45 minutes to go through, and I'll make sure that most of the answers are answered. Um, okay, so number one question. Tell me about your book.
Sorry, tell me about the book.
Yeah, your book.
All right. Okay. So yeah. So the book, like I said, it is as you can see from the subtitle, is how to build the best relationship and get the most out of a vet, so your pet wins. As a Roman discussed, there's this sort of golden triangle whereby we should be working all towards each other, and I think a sort of a misconception both by the vet and the pet guardian is that if your animal is sick, you come to the vets, you show to the vets, and the vets will diagnose and treat the animal. The reality is that the only person that knows the most about your animal is you, and you should be teaching me about your animal, what are the habits, and tell me more about your animal. Then I'll just merely give you the medical side of things and work with you to find out what you want to do. So that's a first misconception. So a lot of pet guardians, they think that you're the vet, you should know. And that is a misconception, because you simply do not go to your doctor and say that I am sick, heal me. There's always questions to be asked, like all the different questions, and you have to know the answers. The second bit is for the vets themselves, because if the vets, they feel the pressure that we must know the answer, and the reality is that, as you know, nature is very, very diverse, and there's all sorts of different medical conditions. Sometimes we may not know the answer, and we just need to go to the next step to find out more. And certainly we should be working with you, as I mentioned earlier on, because if you don't trust me, you won't trust what I have to say. And fundamentally, it is you who is actually treating your animal. I'm merely giving you the medication. If you do not treat the animal, you do not give those crucial tablets at those crucial time, or change that husbandry behavior, the animal still does not win, so to speak. So that is where I think I'm quite passionate about and that's what this book is about. It's to teach you how to get the most out of vets. It addresses common conceptions. Why are there two biggest issue of complaints would be the vet is not listening to me, or the vet is too expensive, or it's a ripoff, or something like that. So this book specifically tells you exactly why, what to do about it, and the end result. If you actually do that, you will get a much, much better understanding. So that is in a gist, really. That's what the book is about. Yeah.
Perfect. I love your book. I love the concept of the book because it clears out the field of misconceptions. Me personally, I thought vets are ripoffs. All they want to do is sell you medication and make it worse than it looks like.
Mm.
And I was surprised to meet a couple of good veterinarians through my period working with rescues that were so passionate, just like you, that were looking to get information. And I didn't have the answers. And I was like, I don't know. How do you know? Most of questions was, I don't know. Like, how long does he have that? I don't know. I just got the dog. Okay. What are the other symptoms? I don't know. I just got the dog. And I was like, wait a minute. This person doesn't have information. He just sees a screenshot of a dog's life in 5 minutes. And he has to make a decision, a life-saving decisions, whether or not he should do this or that. So he's not a psychic. He doesn't have this golden medical ball with what is wrong with his dog kind of thing. It doesn't work like that. So I see that also working as a holistic behaviorist, that I have so many questions. My questionnaire is about 3 pages long, and people are like, are you kidding me? I have to fill this, I won't say the word, up until we meet? I was like, yeah, because otherwise we're going to waste your money and your time talking about stuff that I can see in one picture once I have the overview. Okay? And so it's important that people become aware of their animals and their regular standard behavior and how they feel standard. That's the way that with people. And then once we see a shifting, then we have a reference point. And that's why I say to people, you get a dog from a shelter, from a rescue, the first thing you go is you go to the vet and create a baseline and recognize things. You do Titer testing because you want to know if the dog has been previously vaccinated or not. And if you already show symptoms of overvaccinations, you start discussing with your veterinarian how to treat those. But I'm a holistic behaviorist, and my approach is more holistic. And I recognize some people was like, I'm not going to the Westies, I'm going to the Easties. And I was like, you know what? There are 2 things. We have the modern medications that do quick results, and we have the classical Eastern medicine that is a little bit slower, but it has less side effects. And I would like to go to a vet who's integrative, who integrates both fields at the same time. Get the beast out of the system as quickly as possible, and then transition right back to the maintenance and recovery. What do you think about that? How do we prepare our dogs to go to the vet, and how can the vet be prepared for receiving the pet for care?
Cool. So thanks for the question. I think there's a couple of questions over there. I'm just going to address them one by one, and therefore we can understand why people struggle with that in the first place. So firstly is how do you prepare your dog to go to the vet? So it really depends on what exactly do you mean by that. I am a big, big advocate for bringing your dogs into the vet without problems.
Happy vet visits. Let's do this.
Because the point being is that if you only go to that place when he's going to be examined, he's going to be probed, he's going to have a thermometer up the backside, he's going to have injections. No matter how I make the place, even this whole background like this, it's not going to change the fact that horrible things happen whenever you go there. Whereas if you have a habit of going to the vets just to weigh the dog, play with the team, have a bit of treats, and just have a chat, really. If we see the dog 20 times and maybe one time we examine it and treat it because that's when it needs problems, then that is going to be slightly easier and better for the transition. So that is that. I can appreciate many owners, many sort of pet guardians, they can't really afford the time to just pop by to the vets. So it is certainly for the selected few who can incorporate a visit to the vets, maybe on their walks, so to speak, if they happen to walk past a vet practice. So that is one of the most common things which we would advise, because no matter how you do it, if they only come here to have horrible things done, or perceive horrible things done because they don't really understand, they can't really appreciate that, look, you're sick, this guy is going to make you feel better. They can't appreciate that. They're just like saying, why are you poking me again? That is a challenge. Other ways to sort of prep your pet. So certainly we have got some dogs that is extremely nervous and they actually have got a completely adverse reaction to coming to the vets. There are various sort of methods depending from dog to dog, case to case. So some animals we only examine outside in a car park because bringing them back into the to the consulting room is just way too stressful. Their heart rate goes up, their breathing changes, and maybe even the temperature goes up. So it's very, very not easy to get any constructive information anyway. You might as well examine them in the car park. Some of them are, so you got to understand them. Some of them are better without the owner. Some are better with the owner. So all these sort of different things, because some of them, they just get petrified when somebody approaches the owner. You take them away, they're very, very friendly. They stay the owner, they become quite protective. So it's all variations and differences in different pets. They all have different needs. And it's just understanding those needs. And that is where you need to have a good relationship with your vet, because when they know that, then they can tailor each one, because not all animals are the same, not all pet gardens are the same. So that's how to prep your vet, really. And I think the second question is how to have a holistic treatment. So fundamentally, I think we must understand one thing, that the vet's intention is always to try to make an animal better. How he does it may be different from how you do it, but it doesn't change the fact that everybody's intention is perfect. So it's not as though he's trying to do anything bad, because if he was, he wouldn't be in that job in the first place. So it's just an approach that's different. So that is a case of communication and understanding, rather than you're doing it wrong, you're not doing it how it should be. Because the reality is that the vet can only do what he or she knows. If he knows, or he or she knows other methods and to incorporate that, then yes, they would introduce other methods to incorporate that. But as you can imagine, not all methods are available to all vets in terms of knowledge, what is being taught in college, the vet's personal interests. It's just like anything really. Go to your GP and you want to talk about different things. The GP can only advise you what he is an expert in. So same as your vets, they can only advise you to what they know, what they are exposed to. And also to a certain extent, if they're not exposed to that, they probably will not even want to mention it, because the point being is that if they cannot be sure of what the outcome is, if they mention it and it doesn't work because they don't really understand it that well, they just want to mention for the wholesomeness, then it is very easy for the pet guardian to say that actually my vet said that it didn't work, he doesn't know his job. And the reality is that you're right, your vet has advised you something that he doesn't know anything about. So that is a bit dangerous. So that is why vets, they may appear to say no to certain modalities and treatment, not because they're against it, more because they want to actually give responsible advice, and they cannot advise anything that they do not understand. So that's the thing, really. So coming back to your question of how do you get your vet to treat holistically, it's all into communication. So in the book, I've discussed that, how to talk about alternative treatment, complementary treatment, things like acupuncture, natural herbal remedy, Bowen therapy, bug flower remedy. How do you get all these sort of things that is not taught in vet college to your vet? And there's certainly different methods that you can try. If you can find one that does it, amazing. You can usually find it from the website. But if not, you can share with your vet your thoughts. And as long as everybody's making informed decision, then everybody wins.
I totally agree with you. I had a couple of incidents where I went to different veterinarians for different reasons. One reason why I like the integrative veterinarians is because they have these options to not go only one route, is to see the whole thing as an overview and see, okay, my dog has fever, let's treat the fever. At the same time, I see, why does the dog have fever? I'm not a veterinarian, I'm just saying my own words here. And then start combining situations. Nutrition, like food healing, okay? Food medicine is a medicine chapter. It belongs into the veterinary care. Veterinarian, unfortunately, don't have nutritional education. Unfortunately, it's all sales pitch. I've talked to veterinarians, says, well, we had only 4 hours of education, blah, 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 package number 1, package number 2, done, check, next. And I see how many people are struggling. I worked with people who I took care of their dogs because of behavior issues, and the first thing I recognized, the dog has severe allergies. The reason why he bit the person is because he had an ear infection and because he was feeling miserable all day long, right? And then I asked the person, what is the dog's allergies about? She says, well, he has allergy to chicken. And I was like, great. So I opened his bag he brought me to, which is a prescription diet, and it is made out of chicken. And I was like, what? I'm like, what? That's what my vet gave me. I was like, sorry, did you check in with the bag? But he's like, did you just blindly take the bag and leave? Oh, you paid $100 for that bag. And then she's like, I'm not changing the bag the vet gave me. I was like, please give him a call. You're triggering a dog with allergies you tried to treat. It doesn't make any sense. Anyway, and there are other things that happen here. For example, I had a dog who was very sick, and so we went to a different route and tried to go holistically at that point. And my dog had difficulties breathing. He basically had only abdominal breathing, and he had hard time. You can see how he compressed his belly to breathe, right? And the veterinarian did not suggest any X-rays to see more, because we had an X-ray about the belly, but we didn't have X-ray about the chest. She didn't suggest the chest. She went straight to feed nutrition. My dog was healthy feeding because I'm aware of feeding practices. And I was like, come on, man. I didn't want to tell her what to do, but I packaged the whole thing and went home. And then, yeah, my dog didn't make it through at the end. But anyway, we need to look forward when we go to the vet. There are also aspects that you very well mentioned about the stress factor. And I was wondering, how can a vet evaluate a dog's emotional state or body conditions if just walking into the veterinarian, his hormones are going all over the place, his heartbeat goes up, his heart starts beating regularly, he's getting totally stressed, you can't even touch the dog in that level. So, and I recognize that you have a fear-free practice. And I'm a fear-free practitioner too. So my question is, how can we tell people what's the difference? Like, my vet has this good vet techs that know everything about it. They just take the dog, bring him back to the back room. We don't say what's happening behind the closed doors. And then you see a vet like you who has a fear-free vet care, and the dog comes in wagging his tail and is like, hey guys, what's up? I'm here again. What do we do today? What is your take to that?
So it is. I think first of all, we have to really get down to the fundamental basis first. Why is the dog here? So if the dog is not in for a good reason, the question is, should we even have the dog here in the first place? Apart from socialization, like what we discussed before. So if the dog is here for, say, example, if the dog was here for because it's been vomiting, okay? And so the main problem is vomiting. So it can be a fairly serious thing, or it can be a very, very benign thing. So that is where I rely a lot on the owners as well to ask good questioning. So even before I touch the dog, a lot of my consult is based on speaking to the dog guardian to say that, actually, how long has this been? What is it like this? And I can see that it's breathing really rapidly here. Is this normal at home? Is this what he's doing at home, or is it just over here? Then, with increased communication, my pet guardians, they're usually saying that, no, don't worry about it. It's just over here. At home, the breathing is okay. So I tend to downplay that breathing issue unless I hear something, obviously, in the stethoscope that's wrong. Another thing that sometimes they can help very simply is also they can take a temperature at home. Under the home condition, they can take a temperature. So they can tell me what the temperature is. Over here, I take it, it's the same. Amazing. If it's 1 or 2 degrees higher, maybe that could be due to stress. But if I trust the owner to tell me what the results are, then I can downplay that as well. So a lot of it is communication, really, to know what is normal for the dog in my setting, in the vet setting, or normal at home, so to speak. If I say that the breathing is really fast, is it like this at home? Then the owner say, yes, it is like this at home. I'm less likely to think that this is due to stress coming over here because the guardian is saying the same thing. So there's a lot of communication. So, and on the clinical examination itself, you're right. Okay, like the heartbeat, it well could be increased. So my question is, how fast is fast? Is it fast to a point of pathology, or is it just fast normal? It could be due to stress. And that is also coming back to, why is a dog here in the first place? Is it in for a heart problem, or is it in for a vomiting problem? And it's in for a vomiting problem, then my differentials in my head is different. If the heart rate is fast, I'm thinking stress, pain. Okay, pain. Let's talk about pain. Where is it from? I palpate the tummy. If the tummy is very, very relaxed and nice, and the heart rate doesn't increase after I do that, then it's most likely to be stress. But there are a lot of subtle subtle signs that we picked up, and we always do a complete picture together with the pet guardian's testimonial at home, the history taking, before we come with a sort of conclusion. So it's not, that is why to a certain extent it is it's possible, anything is possible, but it is unlikely for vets to be replaced by AI, because there is all these subtle nuances that has to be asked before we can make a suggestion or a differential diagnostic list in the end and where to go next. So that does it help? Certainly for fear-free, we are always looking at fear-free, but we also have to be practical, because if fear-free means don't come to the vets, that's definitely achieving fear-free, because they won't have any fear if they don't come here. Certainly the way we handle animals, the way we speak to the owners, is a lot of communication with the pet guardians before we actually handle the animal in the first place, and we know what we can do with the animal to get what realistic findings to use for diagnostics.
Right. What do you think about those internet veterinary, let's say, subscription?
Okay.
Are they helpful as a veterinarian to take off that pressure of, it's like, I need an appointment now, my dog is coughing, and you're like,
All right. So sorry. Tell me more about it. So it's an internet vet subscription to give vet advice.
yeah, give vet advice, proactive rather than reactive. Like, you go in, your dog shows several symptoms. Before you start packaging the dog, throw him in the car and drive 150 miles to go somewhere, you have a veterinarian call in and ask a couple of questions to kind of like either is the problem, it's like, you know what, that's normal, he just has a cough, like, what was that actually, oh well, he was drinking too much water yesterday, could be a reason for that. You kind of like make this helpful decision whether to go to the vet and do an emergency, or make it just an appointment and go to the vet. What is your take on that?
Yeah, so I think it does certainly have a place. How people use it is another thing. Without something random, if you're calling it veterinary subscription, another way of looking at it is that if somebody calls me out of hours and I have a first conversation over the phone, and I have to determine whether I have to see that pet or not. So that pretty much is almost like what you're saying already, except they're calling me straight compared to calling a subscription. So same again, obviously for me, I have the advantage of actually potentially knowing the customer. So I know what is a customer like. Is that sort of person likely to panic, or is he fairly level-headed? And the fact that she's calling me means that it is very, very serious, so to speak. So I think it does have its place. And certainly if it's something simple like, my dog just had a bit of chicken gravy. I read that it was poisonous, and those are advice okay. If it comes to like my dog's eye is not opening, then I think to be able to so-called give a consult over the phone, that would be a bit challenging. The consult would probably be bringing to a vet, so to speak. So I think it's just an initial vetting. I think it certainly has its place, because what we consider as emergencies may not be the same as pet guardians. Yeah.
I've seen many times, especially with rescues, we bring the dog to the vet first to do the vaccinations. I mean, that's a general concept, at least in the US. I don't know how it is in the UK or, in the Far East. The first thing you do, you take the pet, snip, vaccinate, medicate, go home, rest. How do you feel about that? I personally think I'm weird about it. And I always suggest people, you get a dog, you have to make sure that he's healthy. Don't add more to it as already is. Just check. Make sure the dog has time to calm down. Make sure the dog doesn't have any emergencies. And then start creating a bond, create a secure attachment relationship, help the dog calm down. Then you make your appointments, do a Titer test, do a fecal test, do a urine test, make sure there's no underlying cause that for any may have a problem with your care at your house, and then you check in for further adding things to the dog. What do you think about this? Is this the right approach, or am I just nuts?
It is. I think what you've just described is very almost like protocol for most rescues, whereby any dog goes in, they will do the injections. If it's not neutered, they will neuter. Then after that, they will rehome it. And what we also know is that this comes into a system, into a protocol. So the question is, why did it happen in the first place? And that is very difficult. Perhaps, and I'm not saying it is, perhaps in the past they have found that if they don't neuter the dog, it goes back there and is used as a breeding animal, producing even more animals to load into the rescue center. So it doesn't really solve that problem of wanting to, why do rescue centers even exist in the first place? The fact that rescue centers exist obviously shows that there's a demand for it. There's unwanted dogs out there. And certainly unneutered dogs, if not taken care of properly, because not all pet guardians are as responsible as others, then they can proliferate. And hence, one simple way of which, I'm not saying the right way, is just one simple way of the sort of rescue center doing their job is to say that, okay, once it's under my care, this animal will not breed again, and that's by offering the neutering service. As for vaccination, it's the same. It's very similar school of thought, really. They have not really understood whether the animal is been vaccinated last month, got missing, and hence it's just a blanket protocol to make sure that the unwanted diseases are not found or are not going to be spread by these animals that they have rehomed, and hence that's just a protocol. There are some rescue centers that's a little bit more specific because they know that, okay, like you said, they are more concerned about the welfare of the animal itself, but it doesn't change the fact that obviously this animal has been abandoned, which is why it's in their vicinity in the first place, and they have to find a home for it. And to a certain extent, if they trust, they know the person who is going to do the rehoming is going to be responsible enough to do all the necessary things, then they don't have to do anything. But the point being is that the reality is they have no idea. They are just needing to have the animal turn over, because every time they rehome an animal as quick as possible, it allows one more kennel space for another animal to come in. If they keep holding on and on and on and on, they can't take in any more animals. They help less animals in the long run. Does that make sense? I'm not saying it's right. I'm just saying that that's a way they can hurry up, turn it over. And a lot of people who go to rescue, they've already had a mindset that I'm going to rescue to pick up because, number one, I don't want a puppy. There's so many rescues to be done anyway. And it's going to be neutered, so I don't have to worry about that. It's going to be vaccinated. I don't have to worry about that. That actually increases people who actually apply to adopt more animals. Mm-hmm. And same again, like I said, it is one of those things that we can sort of talk about it. And the question is, should it even be rehomed? Because some of them don't. So you got two sort of shelters. One does rehoming, one doesn't. The one that does rehoming has a very high turnover, and any animals that cannot be rehomed, unfortunately, they may even consider euthanasia. But the plus side is that they help a lot of animals. On the other hand, the shelter with the policy of I do not euthanize any animal, the kennels just keep getting fuller and fuller and fuller because they can't rehome it and they help less animals. So it's not right or wrong. It's just what they get.
We'll talk about that because that's a whole chapter, and I think you have already experienced with that in your practice, and I like the variety of knowledge that you have around that chapter. I'm gonna bring one of our next shows. I bring somebody who works in rescue, heavy duty, saves thousands of dogs through advanced, examples in rescue care.
Mm.
One thing that I would like to mention, because I was always in a problem zone with that, is bringing a dog to the vet at the first place. Because what happened there, it was unsafe for me to bring my dog in there. I bring a rescue, I just got the dog from a rescue, he has a bite history, and I need to go to the vet. I have to wait in the waiting room with cats and dogs and birds and turtles and snakes and whatever, sitting there while my dog is going nuts, trying to kill everyone. Okay, while I have to sign a paper holding my dog on the other hand, who's 75 pounds, or I leave him in a car, which is illegal too. So I'm kind of, what do I do? You know what? I just skip the vet. Forget about it. I'm not just going. And then I'm asking a vet to come to my house. He's not coming because my dog is aggressive and I cannot visit the vet coming to my house. For example, I'm just giving an example of clients that I worked with in the past. And then we have the other people who are just slaughterhouses. You bring your dog in, they literally slaughter your dog with literally no empathy to the dog's problems, no empathy to the dog's separation anxiety. They just call it aggressive and just, downplay the whole situation, saying, you know what, you shouldn't have that dog at all. He's going to kill your family. And all the dog does is traumatized at the vet's office, which I see very often
Mm,
in the age of 6 months, where the second fear phase kicks in. Dogs being traumatized by the handling of the whole situation, but
mm,
most likely coming into the vet and be
mm,
unsafe in the waiting room. It's a disaster. Like,
mm,
and you know, the spaces are expensive, and running a vet care business is really an expensive game. All the apparatus, you have to pay ahead of time before you even earn the money. You have to spend all this money in there, the medication and the care, the personnel, and all this stuff. And
mm.
then you have the small waiting room because, of course, square footage is expensive. You need to, you know, create rooms for it, and for all these chapters that most of them are in the background, only on the foreground. You have this small area where all
Mm,
these things are happening. What do you think
mm.
about safety in the waiting room? Do you consider, and I'm not blaming or saying anything, I haven't seen your vet office yet. Do you feel your vet office is safe for people like me, for example, to walk in? Do you have
So
backup plans?
this comes back to communication again, really. What are the needs for each individual? And not all dogs are the same, not all dogs have the same needs, and not all dog guardians have the same needs as well. And that is where it has to be a little bit more custom. And I'm not saying it's a problem. One challenge to that is because if the initial understanding, the initial foundation is not laid down yet, as in you have all these different expectations of, okay, I know what to do with my dog, and my vet is not asking me, and all your vet has the expectation is each consult is 15 minutes long. I put in as many as possible because we have to make the money and all the sort of usual business stuff that we talk about that we have to do. So fundamentally, it comes out of communication. So there isn't any mutual understanding or trust between the vet and the pet guardian to start off with, even minus a dog, so to speak. And if the conversation isn't held in the first place, whether it's by either party or both parties, it's like you said, your friend with the chicken. It's like you tell me a dog is allergic to chicken. Why don't you tell your vet that it's allergic to chicken? It's like, yeah, but the vet gave it to me. Yeah, but it's your dog, so you got to take the responsibility to say that you are your dog's guardian. You should be in charge of your dog, not the vet, so to speak. And if the pet guardian doesn't express this in the first place to the front desk, then the vet wouldn't know any different. And the vet's practice itself, if the vet practice has got a protocol of, okay, let's find out more about these people first before we even take them in to find out what's the best way, the most effective way to do what we need to do, then if the conversation is not asked, it's not held, then that is quite difficult as well. So in the end, it comes back to communication, really. And communication can be passed through in a lot of different ways. For the vet practice, we have, it's a website, how we discuss a website, how we market ourselves, and what to speak and things like that. And obviously the customers review as well. They can see how they can accommodate to all their different dogs, so to speak. So for ours, we are very, very bespoke. First of all, I'm the only vet here. So you do not get more than one person in the waiting room. So despite our big waiting room, in my 3 different consult rooms, we've got one specific for cats, a big one for dogs,
Oh,
and
thank you.
exactly, and after that, another smaller one, which is this one that you can see over here, just our 3rd room. So
This is for birds.
sorry,
This is
yeah,
for birds and fish.
I would say that, but it's actually a sort of the quiet room as well. So yeah, so it really, really comes down to communication. So all those issues that we just discussed can really be sorted out by communication. And the reality is that we have no idea how a dog is going to react anyway. Despite the best intentions, your vet may not even get to go near your dog at all. And it will be observation from the distance, and that's all the consult you can have.
Right, right. So I see many behaviors. I would say, literally, give it the number, 80% of behaviors have medical underlying causes. Do you agree with my concept, or am I just wrong?
I Medical, certainly I've seen a lot of medical issues that has caused behavioral problems. I think a lot of it is also past experiences, because if they're rescue animals, if they were living in a home that got beaten on the head every single time, of course they're going to be head shy. So it may not necessarily be medical. So in my experience, there usually is some reason. It
But
is possible but highly unlikely that probably a small percentage. That one I got no numbers, but it's very unusual for them to be born vicious, so to speak. They
Exactly.
usually some inciting cause, either medical, psychological,
Mhm.
past history, something like that. That's my personal experience.
I see, for example, many people get bit. In US, we have numbers about 3.2 million people get bitten every year, and about 400,000 children end up in a ER because of bite incidents, and are really usually from dogs they know already. I can say from my appointments this week, I had at least four online clients who are um, reached out for behavior help where their dog beat people or attacked people and asking a few questions. I think usually about third or fourth question ends up to be yeast infection, ear infection, food reactivity, um, survival response because of health condition, because of stress, because of trauma, because whatever reason around that. And then I see very often responses to vaccinations and treatments that have side effects, and people don't know that because they don't read, because they don't educate themselves, because they don't trust what they read. Sometimes it's difficult to find accurate resources. Um, Many things of that you have covered on your book, and I just wanted to go into, um, let's say, four behaviors that you recognize most in your practice that come in from medical conditions that people should know. It's like a no-brainer, dude. First of all, suspicious that before you even call me, kind of thing. Which one would you suggest?
Number one is pain.
Yeah.
If it's in pain for whatever condition, he's going to be grumpy, just like us. You have a headache, and somebody talks to you normally, and you're like, "Excuse me," or somebody touches you, you're like,
And
"Please."
dogs do have headache. People
Yes.
ignore that. Just because they don't say they have headache doesn't mean they know.
Yeah. So pain is number one. I wouldn't say I would use this as a disease, but pain as a symptom
Right.
due to a lot of other things can be a huge factor for behavior change. We know certainly, especially in the one most common example will be arthritis. So arthritic pain can certainly cause, or chronic pain can certainly cause animals to be grumpy. Classically, like cats, they get arthritis when they get older, potentially. And because we don't see them like dogs, we don't walk them, it's very hard to say whether they are walking as far or things like that. But one thing is that they get more grumpy, then that certainly could be a sign of arthritis. And sometimes what we do is we give pain relief, and your cat becomes the most loving cat ever. It was just purely because of pain. So that is one thing. Pain is one thing, and another one that we usually find in younger dogs when the owner comes, when the sort of guardian comes to say that the younger dogs is bitey or vicious or something like that. Sometimes, not all the time. I'm not saying it's all the time. It's the guardian themselves, because their personality is just not suitable for that particular dog or that particular, yeah, whether it's breed or that particular dog itself. Because if they are some dogs, they're just naturally a bit touchy, a bit nervous, and things like that. And if your personality is you're going to be nervous and start jumping as well, it's going to stimulate the dog to be to heighten the sensation. So that's what I sometimes find as well is it's the guardians themselves that probably would need to learn about their dog better to to help the whole biting incident really. And a lot of incidents that I see due to biting, when you listen to the story exactly from front to back, there usually is something. It's like, why do you do that to the dog in the first place? No one is going to bite you. So it's something that's done rather than just sitting out of nowhere. I come in and give you in the house and turn around and just bite you. So that is much less common. Usually that you can take it down to a particular reason.
Informed decisions.
Yes.
How do you feel people are informed when they make decision and the vet asks them a question and says, yes, let's do this?
So good question, very good question. Something which I really am passionate about, because the first thing to say is that I always advocate that you are in charge of a pet. Don't tell me you're doing it because I said so. You must make the decision yourself. My job is to give you an informed decision. So I'll tell you the different options. I'll tell you the pros and cons. then you make the decision yourself, and I usually would support you. If not, I wouldn't have given you those options in the first place. So, but the thing is that it is the pet guardian that needs to make the decision. It's just like having a child. If you're a parent, you've got a daughter, you've got a son, and you're given options whether to do vaccinations or not, whether to go for this particular treatment because of this condition or not, to go to what school to choose. You are making an informed decision. You cannot say that so and so said that I should do this, hence I'm doing it, and taking responsibility really. So that's the key thing. So the question would be whether you are informed or not. Okay, and that comes back to how's your communication like with your vet? Do you do background knowledge? Do you do background check? What's the length of the consult time? Do you even have time to talk about pros and cons in the first place? And that's where a lot of vets struggle. They want to give as much as possible, but they only have 15 minutes. I'm Chinese, I speak pretty fast, but even then I struggle to get in all the information to the pet guardian, and also the pet guardian has assimilated understanding in the brain and try to make a decision like this. That's no joke, because for me, I'm trained. The vets, they are trained, so they know the pros and cons. They've seen it. But even if you do not know anything about this, you're given all the pros and cons, you still have to make some decisions. It's really, really hard to gauge. So I'm a big fan of informed decisions. The question is, how do we get it across? Whether it's increasing consult times, which is why our consulting time here is half an hour. For the one big thing is that we charge for it, because half an hour is half an hour. So that's a difference. And I'm a big fan of people using Google. Many people don't like it, but when they actually come in to say that I've just been on the internet, I'm like, excellent. At least you're interested. Compared to people who just say that they come in with a dog and no understanding of the dog whatsoever. I'm like, what do you want me to do? Then they go, you're the vet, sort it out. I'm like, what?
Yeah. I feel we have to be very careful. We see a veterinarian as an oracle. You go in there, get information. You have no clue about decisions that you have to make. Should I put my dog down, or should my dog leave? Should I do this? Should I do that? Should I spay? Do I neuter? I mean, I feel like some people have literally no clue.
Yeah.
And they just watch on the vet's mouth to get it out. And then I cannot make the decision. I don't know your family. I don't know what you're doing 5 years from now. I don't know how many dogs. How would I give you that answer? Now, scientifically speaking, you should do this or you should do that. I only can give you information to make your decision. I'm not your father and your mother making decisions for you, as you have to make decisions for your pet and you have to live with it.
Yeah.
And if you don't like right?
Yeah, just two things I'll say about that. One is that some people, they actually cannot, they just haven't got the capacity to get the information in, and they really just rely on me to say that. So two things. The first one is that is why it's so important that the bond must be there already. The trust must be there. The expectations must be shared and understood. So if I know that person's expectations in terms of what they expect the pet to do for them, or what they can handle at home, what they cannot handle at home, their financial expectations, what they consider as a good quality of life, and if I know that, then the decision that I make is likely to be much more fitting with what there is over there. So that's the first thing, is more understanding really. The second thing is that owners, they always turn it back to say that, if it was your dog, what would you do? Then I would usually say that if it was my mom's dog, this is what I advise her. But that is, I'm advising that. To help them, because some people, they actually cannot make decisions. They just say that I actually do not know. It's too overwhelming, which I don't blame them. It is overwhelming.
Right.
4 different decisions, all with pros and cons. Every single one has got 4 pros and 4 cons. That's 16 choices to make. Some people, they actually cannot handle it, which I totally appreciate. And hence, if I know them well enough to say that this is probably what you would do, you just do not know it yet, but this is what you do, then I'm in a better position to speak to them about that. That's because I know them. That's the thing about communication. A lot of problem is that people, they do not know their vets. It's almost like getting married on the first date.
Exactly.
You do not know that. You go there, and then suddenly your dog is sick. You got to make all these decisions that involves money, health, medicine, all on the spot to a stranger that you do not know.
Right.
You know it's the vet, but that person has no idea what you know, what you want, and you have no idea what he wants, and that's a disaster.
Right. I have some questions. Barbara, my wife, by the way, I've noticed that pets are affected by their owner's emotional state and often have similar physical and emotional issues. You
Mm,
researched that. What do you think about this, and is it beneficial for the animal's healing process if owners understand this?
I love it. I love this question. Okay, the reason why I love this question is because there's actually a scientific paper that come out that what they did
Oh,
was they measured. I'll see what I can find it. They measured the cortisol level. The cortisol is a stress hormone that
hmm
our adrenal glands excrete. Okay, so what they did was they measured the cortisol level of the dog, and they measured the cortisol level of the pet guardian. And after that, so they did a few different studies. So they compared that. Then after that, they also measured the cortisol level of a dog before and after exercise. Okay, so like agility dogs before going for the agility training, before and after. What they found was very, very interesting. If they found a direct linkage, okay, if the owner's cortisol level is high, i.e., the owner is always stressed, the dog's her or his dog's cortisol level is going to be high, regardless of what they're doing, even sitting on the couch watching telly. If it is low, if the pet guardian's cortisol level is low, the dog's cortisol level remains low even after agility class. So it's directly linked to the to
I see that too. I have the
look at
same I have the same conclusion.
this is what I mean by sometimes the dogs that get stressed. One of the factors is it could be pain, or it could be just be the pet guardian. If the pet guardian is always stressed, the dog could be the most chill out dog. You give that dog to that pet guardian for 1 or 2 years, your dog will be a stressy dog. Same for the other side. You get a very, very stressy dog, you rehome it to a very, very calm person. Just the calmness of it, minus all the sort of behavioral lessons that you go for. You are calm, your dog will be calm. So it really, really is true. Your dog, you look at a dog, you know what the owner is like, and vice versa.
Right, right. So we
That's good.
have Isabel Mary. She's from Santiago. She's a 12-month-old Neapolitan Mastiff. Don't
Nice.
need explanation about how it looked like. It's stinking cute, right? She's very timid, and she has an appointment with the vet next weekend. Should I wait until he's a bit more acclimated?
Very good question. It really, really depends. There's no straight answer to this. The questions that I ask myself would be number one, does he get stressed in the vets in general? So because he's very timid, but yeah, there's many dogs that's very timid. And number two, would you consider taking him to the vet without the vet saying him? So just to check it out. So like what I say, why do you just take it to the vets but not having an appointment? Just walk around and say hi to the people, give a bit of food, and see how he reacts. The reality is that no matter how calm he is at home, if he's going to be stressed at the vet, he's going to be stressed anyway. So you're talking about getting him more acclimated. Maybe it may help, but all I'm saying is that if he's having a problem with that, then he's going to be stressed anyway. And I can see over here, Isabella, not having a relationship with a vet is number one concern. So is many pet guardians. So just like you, COVID-19 protocol, turn a dog over, require to wait in the car. So that is also very, 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 very challenging. I mean,
Mm,
obviously, I run a vet practice as well, and at this moment in time, we do not have people coming into the practice.
yeah,
Okay, so we are fairly, to a certain extent, it depends from pet guardian to pet guardian as well. Some dogs, they love us. Okay, so there's no problem saying bye to the guardian, come into the practice, we do the examination and bring out again. So they haven't got that. For those that struggle, okay, we tend to see the dog with the pet guardians in the car park, and we've got a little gazebo as well.
right.
That is
From a
our
behaviorist perspective, I totally agree with you. I work with a couple of clients who just rescued a dog who's reactive, goes after everyone, is territorial, guards his person because I work a lot with guardian breeds. I said, you know what? Set up a clinic in your backyard.
Mm,
Set up a clinic in your driveway where your dog has never seen before and start working on it. Set up a
yeah,
table, set up a bench, have a
yeah,
stranger coming or your husband stand out there and create that introduction idea. So create that, let's say, episode of meeting a person
yeah,
there, not in the house where the dog is reactive, outdoors where it's much likely better. take a vet for a walk.
Yeah.
Have the
Yeah.
dog approach the vet from the past as he goes ahead. So the dog has time to smell, because usually guardian breeds are confrontational. And if you face them and you ask this question, why are you staring at me like that? He's going to be reactive anyway. And
Yeah.
it doesn't have to happen at the first sight.
No.
It could be a first introduction, a second introduction, and third the exam.
Yeah.
Sometimes, right? Sometimes the vet can ask you questions and you can test it yourself. Like, do you
Mm.
feel the belly's hard? Do you feel, stick a finger in your ear? Does it smell like cheesy or frito? Some people have a frito smell kind of idea. What do you think?
Yeah, I think knowing your dog helps, although I don't presume everybody to do that, so to speak. So similar again in the book, I've given a lot of different things that you can actually do at home. But same again, some pet guardians, they just simply cannot do it. One thing to say about before I dive into this question a bit more, for Isabella, another big factor for coming to the vets is actually the car journey itself, whether the dogs they get stressed in the cars, because if they do, then you're already causing a stress factor to happen even before going to the vets. So if you're interested in that, there's a lot of other things out there to help you to acclimatize your dog to your car in the first place, because that is certainly one big potential problem. Yeah. So back to your question of is there a lot that that the pet gardens can do at home? Yes, there is. But also, I totally understand that some pet gardens they just simply cannot do it, because some of my pet gardens they are either physically disabled or they are in their 70s, 80s, and they simply cannot check the teeth or listen to the heart. They wouldn't even know where to start. So a lot of communication as well, to say that there's some things that the guardians can do, some things they can't, and what your dog needs at the vets is really quite specific as well. So the question is, when you're going for the vet check, what exactly is it for? Is it just for the customary vet check that you have after rescuing an animal that there is actually nothing wrong with your pet? So that check will be very different from having a full cardio examination and things like that. So it really, really varies, and you have to weigh the pros and cons to say that, okay, as much as I want to do a full examination, what is going to be the best for this particular pet at this moment in time without causing too much stress. So same again, back to communication again. What do we want to achieve from this visit? Is it just purely to acclimatize, or is it just to actually, I'm worried because it is not eating very well, it needs a full vet check? So obviously that one you can't wait. Yeah, does that answer the question?
Right. Wow, it's been already an hour. We really covered pretty much everything. I mean, I know things. I don't know how about you guys who are watching us and are patient for an hour almost. Thank you so much, Dr. Fo, for joining us today. And I think we kind of create a better relationship, right, with our vet. Um, People are very grateful for that, and I'm especially grateful for taking time from your day. And it's evening right there in UK. I would love to have you around. And just a heads up, you are also one admins of our Facebook group, Holistic Dog Training, Parenting, and Foster Care. Um, and you're sharing. I love your articles. Really, they're deep. Like, how deep can it get? Like, kind of thing. And I see how you can combine your education, your knowledge, your experience, and make people think in a nice way. And that's why I appreciate you also having you today, because we cover pretty much everything again. I would like to have you again on our next show.
Pleasure.
We have good questions, especially around COVID. I think we should dedicate a little bit time about COVID on those. Get my vet, get my dog or my dog to the vet during COVID, which is complex, and I maybe get some other
Mm,
colleagues on board to ask you a couple of questions, because we deal with it. We have to deal with it. It has never been before like this. We haven't had this problem. These new protocols are so dog unfriendly. They're maybe cat friendly, but definitely not dog friendly.
mm,
Especially those pets were being home and closed for not unsocialized, because there was not option to socialize. And now all of a sudden, the dogs have to go in a confined space dealing with strangers and have not met before. And
mm.
you know, shit hits the fan right now, and I don't know who I should work first, because all these people have to go to the vet. Thank you so much again. Do you want to share anything closing, like listen.
Yeah,
Just listen.
I really believe in applied knowledge is power. So knowledge is not power. Knowledge actually is very abundant. With Google, you can pretty much Google anything right now, but it is actually applying it. So I know if you're watching this show, you are passionate about your dog. You want to do what's best. And the most important thing, the most simplest thing you can do for that is to educate yourself to understand more about everything, really, to make an informed choice, an informed decision, to empower yourself. And that is where, without something random as well, I highly recommend to get this particular book, because I have
Link
dealt.
is in the comments. Everybody can click on that link, go straight to your website, and they can order. Jesus, guys, it's just £7. Like, you're saving your tons of money just reading that book.
Yeah, so have a look at that. With better awareness, you can make better choices, leading to better results. The question is, how aware are you? So if you're not aware, your choices are very limited, your actions are very limited, your results are very limited. So just empower yourself by learning more. And the resource is out there. So help yourself.
Thank you so much for your time today. Looking forward for the next time.
Thank you.
Goodbye.
Afkaristo. Bye bye.
Barakallah.